Hi, I'm Matt Gunner, VP of National Retail at Sprint. I think when I first met Angelo and Josh of HealthID, the really compelling story to me was the story of Angelo's son, and which was really the inspiration and the driving force behind his creation and commitment to HealthID. I think I really learned a lot about what this business has from a potential to really be a disruptive force in the healthcare industry, empowering consumers to take a more active role in their health, and potentially empowering corporations to take an active role in controlling their healthcare costs. I'm really excited to be part of the HealthID team.
Ladies and gentlemen, please welcome the CEO of HealthID, Angelo Patassi.
This is my youngest son, Angelo. He was diagnosed with diabetes when he was just 3 years old. He has to check his blood sugar by pricking his finger 7 times and taking his insulin 4 times each and every day. He's 11 now, and that means we've had to remember to give him his insulin 11,680 times. If he doesn't take that insulin, there are immediate effects on his health, and he could even end up in the hospital. This is a lot for anyone to remember. Him as a child, certainly us as parents with our busy schedules, and anyone in the same situation. This is why I started HealthID. HealthID makes it easy for you to track what's important to your health. Things like blood sugar readings, blood pressure, weight, allergies, and even emergency contacts. But most important, we make it easy to manage your medications. And HealthID will send you reminders to take them as prescribed, just to help keep you on track. Then, quickly communicate your medical information to the right people at the right time by scanning your HealthID band or card. We began selling our bands and cards with Amazon.com. They've been a great partner for our online sales. But distribution increased when we uncovered the opportunity with pharmacies looking to sell our products. Our first retail relationship began with the leading national pharmacy chain, CVS Health. Our traction since CVS has put HealthID in over 15,000 pharmacies across the US, and since September of last year, we've quickly generated over $590,000 in revenue. This is what we call phase 1 for HealthID, and we will continue to grow our retail distribution. But we've learned from these pharmacies that medication adherence is a massive problem for them. This year, 75% of prescriptions filled will not be taken as prescribed. Why is that a problem? Most important, it has a negative impact on people's health. And pharmacies lose out on $30 billion in revenue. Up to today, we focus primarily on the consumer, and that will continue to be our primary focus. But phase 2 for HealthID will help these pharmacies directly by providing them real-time information about how their customers are taking their medications, specifically showing them who's at risk of missing a refill, so the pharmacy can engage with that customer immediately. So what's next? Clearly, we're starting with pharmacies, but we know the information gathered by HealthID can be communicated to pharma, hospitals, and insurance companies, decreasing cost, improving outcomes, and keeping the patient at the center of their health care. Since starting the accelerator, we're launching 3 pilots to show how increased engagement leads to increased adherence. And 2 of those pilots are right here in Kansas City. Now, there are other applications in this space, but they focus on a single aspect of your health, like a diabetes tracking app, medication reminder app, all the way to traditional medical ID products. But HealthID brings all of that into a simple all-in-one solution that keeps people engaged with their health. And we will be the standard medication adherence platform by becoming an integrated part of the 15,000 pharmacies we already work with. And unlike our competitors, we're not asking people to do anything different. Just opt into the new HealthID service when you go to your pharmacy and pick up your medications. We're a small team, but we've made big things happen. Josh Walsh, VP of Technology for HealthID, and myself, founder, CEO, but my favorite role as dad, who just so happens to get a medication reminder every night from HealthID to make sure that my son doesn't go to bed without taking his insulin. This is HealthID, and we give you more control over your health. And for more information on how you can have HealthID for yourself or a loved one, please visit us online tonight at healthid.com. Thank you, everyone.